the beginning of the pandemic, many states went into lockdown mode. A new Johns Hopkins study claims lockdowns are ineffective, especially when it comes to reducing deaths. And we can all agree the pandemic has had a devastating effect on all of us. Joining me live is Harvard Medical School Professor of Emergency Medicine, Dr. Ali Raja. Good of you to join us this morning, Dr. Raja. A pleasure to have you on. If this study is true by Johns Hopkins, should lockdowns be rejected?
It's a great question, Kelly. First of all, thanks for having me on. I really appreciate it. I think your question, the first part was exceptionally important if this study is true. And I think there's a few things to emphasize. The first is that this was actually a study done by 3 economists, not virologists or infectious disease doctors or other physicians seeing patients with COVID. And it's specifically about looking at the effect of lockdowns on mortality, which is a very medical thing. In addition, of the 3 economists, one's Danish, one's Swedish, and one happens to be a professor from Hopkins. So I think calling this a Johns Hopkins study is a little bit of a stretch when only 2 out of the 3 people are actually associated with it. But all over the press, I've seen this mentioned as a Hopkins study. I think it's important to remember that this is put out as a working paper. It's just their thoughts and their analysis. And it really hasn't been looked at under peer review by anybody else who can realistically look at the way that they analyzed the data and wrote the paper. So I have to tell you, I think that if this study is true, part of your question is exceptionally important because I don't think that it actually is.
That's a very good point because, as you know, the Hopkins University has been actively involved, proactively involved in dealing with this pandemic that we've all been dealing with. And for the most part, they've been extremely effective and responsible for making sure that we understand the sincerity of these reports. Also, talking about the number of deaths that have happened as a result of COVID, some 900,000 and still counting. So this particular study, Doctor, also states that it found shelter-in-place orders reduced COVID-19 mortality only by 2.9%. Do you take exception to that? Again, going to your point, do you see this as being a valid story from Hopkins? Does the study have enough veracity?
It really doesn't. You're absolutely right. The fact is that what this is this is a review of studies that have already been done. And it's a meta-analysis, which involves taking those studies' data and putting it together to do a further analysis. But, this is the thing once studies are out there in the public, is that they get subject to the peer review that they would otherwise go into if they were trying to publish in a medical or economic journal. And so now there's been a lot of peer review by economists, by physicians, by public health experts. And what we've all found is that actually the studies that they chose were predominantly written by economists. There wasn't a lot of medical literature put in there. And they used really varied definitions of lockdowns. Some of the studies were about mask use, which I don't think anybody would call a lockdown. Some of the studies were about actual lockdowns. And a lot of the papers that we've talked about over the past few years showing that masks work weren't included. And so the analysis itself doesn't have, as you said, the veracity that is, quite honestly, even worth discussing.
It sounds like misinformation and politics is seeping through here. Doctors that I've spoken to at Johns Hopkins have been on board about making sure that they take care of all communities. And particularly, they've been proactive about communities of color where, as you know, COVID-19 has disproportionately impacted them and the mortality rate is high. So again, let's put this to rest if you can, because that misinformation that gets out there causes more people to do the wrong thing, Doctor.
I think you're absolutely right. When you cherry pick data from studies and don't look at the overall picture, you can come up with some erroneous conclusions like this. And we've seen that in other non-peer reviewed papers over the years, but over the past couple of years, especially related to COVID. But this is just as true in Boston as it is in Baltimore, where Hopkins is. Communities of colors are being affected by this. And the last thing that I want, or that anybody who's helping take care of patients with COVID right now want, is for people to be hesitant about the public health measures that are being put in place. So let's just put a nail in that coffin. This paper's conclusions are not are not based on an accurate analysis of all of the literature out there, and we should not be discussing or acting on them.
I only wish that conservative media would hear this and listen to you with your clear clarity on this matter. Dr. Ali Raja, appreciate you again for joining us and weighing in on this issue. Thanks for joining us here in DC today. Coming up, as we celebrate Black History Month, we discuss the importance of tracking our mistakes as well. One major mistake by W.B. Du Bois. And coming up,